It's House Bill 2427.
I do, and I'm going to.
Is there a
surprise
substitute or
Sarah
amendments to this?
Here, yes, I have a complete substitute that she does not know about. How do you like that?
The chair will entertain a motion to lay this, and since I don't even know, I'm kidding. Please just let us know. Yeah,
Objection. We got a reason.
That's correct. The intent of this bill was, in the case of services, to let people know the cost ahead of time. What the substitute does, and the reason why it says Senate Bill 1004 is because this is a substitute that did pass a Senate subcommittee. It's Amanda Chase and I have been working together. She co-patrored my bill, I supported her. Is what this bill does is similar to the Toscano Bill Plus. Yeah, they gave it to me actually. The Toscano Bill Plus. So the Toscano Bill says that you have to let people know they can ask for an estimate. The plus is on the back, lines 36 to 38, that requires physicians, physician assistants, nurse practitioners to give folks a good faith estimate. I'll be the first to tell you I don't think this goes far enough. My original bill didn't have the upon request. My original bill dealt with insurance. But I've been around this place long enough to know that this bill, which has the support of those folks behind me, has a chance of succeeding, whereas the original bill, which I think is the better bill, but I'm going to let it go, I didn't think had a chance of succeeding. So I think this bill does move the ball forward. I think it does allow patients to get these good faith estimates upon request. I think that's a good thing. Just because I don't think it goes far enough, I can talk with them throughout session to see where I think it can go farther. But I do think this improves current law by making clear that people have a right to good faith estimates if they have.
all right, does everybody understand the substitute before us? Probably moved in without objection by general consensus. All right, substitute to Senate Bill to 2427 is probably for us. Yes, ma'am. Delegate Mark.
Mr. Chairman, just because I just want to know, is good faith estimate defined anywhere to know? And the reason why I ask is because I worked in dental insurance, and we, with the provider, we would give estimates all the time, and the provider would say this is not guaranteed. But even with that statement, every time that the price was different than the paper that we gave them, there was significant issues to the tune of wanting to keep our patients, we often adjusted things off. So I just wanted to know, what does a good faith estimate mean?
Means whatever good lawyer wants to make it sound and feel like.
I would answer Delegate Price that I think a good faith estimate is what a physician thinks it will probably cost. And in other words, if sometimes you get an infection, and that obviously would be an extra cost that while it was foreseeable, was not the usual case. So I think most doctors know the usual case for the usual knee replacement.
So that's your interpretation.
That's my interpretation.
Yeah, absolutely. Delegate Robinson.
Yeah, I find this problematic because often patients will call the office and say, well, how much is my eye exam? Well, do you have insurance? What is your insurance? You can't look their insurance up unless you know what their numbers are. They have no clue what their insurance even covers. So it's very problematic to give an estimate because you really have no clue. You don't know if they have insurance where they do have to pay and how much their copay is, unless you can really spend a lot, and it's extremely time consuming for everyone's concerned. And again, I'm going with Delegate Price. It's a crapshoot. But once you set a number, and you can give a range. You can give a range, but let me tell you, they're going to go for that low end range every time, and I'm going to hold you to it. And so it's very problematic. Whatever the good faith estimate is.
So
all right, hang with me, Delegate Pierce.
I was just reading what Delegate Robinson was highlighting, piggybacking on Delegate Price. So in the expansion of this, because that's my favorite word, in the expansion of this existing law to the office-based setting, it talks about a good faith estimate for charges, and it's a person who's a patient. But if you look at the existing law on 12, in the hospital context, it's upon request of a patient who's scheduled to receive a procedure or upon request of the patient's legally authorized representative. And it actually goes on to say estimate. Doesn't even have good faith estimate. So when you're expanding and piggybacking and trying to draw this together, it's not constructed properly. So, I mean, I have a problem with the way that it's written as it is.
All right. You're good. Delegate Myers.
And my follow up on that, Mr. Chairman. So if they try to provide a good faith estimate of the healthcare services for those patients, then they go in and they have other services that need to be provided, then that can actually complicate matters as well. So I think that could really be a potential problem. I mean, if you call and, request, I mean, for example, could that be an issue even, with Delegate Robinson,
All right, good.
in any setting?
Hang with, any other questions of the patron?
Because I haven't answered those yet.
No, I understand. Well, they were more rhetorical than they were, I think, sort of overt questions where I think they were making comments and anything else. But let me just hear from them. I will give you the last words, I promise I will. Anyone in the audience to speak in favor of House Bill 2427 substituted? Yes, sir.
Mr. Chairman, I appreciate Delegate Levine hearing our concerns, and even though this was something that it was addressed in the other body, we agreed to that there and we're committed to it. It's not something where we've agreed to continue to work on it. What this takes for the physicians on line 36 through 38 is you come into the office and you say, Dr. Garrett, what is this office called? You, no disrespect, probably won't know, so you're gonna have to yell out to somebody at the front desk that says, what's the charge for an office visit? And they say, $150. And then you're gonna have to tell the patient, but if I examine you, you may need an EKG, you may need something else, and if you wanna know the charges of those, I'm glad to tell you, but don't think it's only gonna be $150. All a provider knows is a charge. The only way you can tell a patient as to what their out-of-pocket's gonna be is a patient decides to pick up the phone and call the health plan and say, where am I on my deductible? How much is my deductible? What am I gonna be responsible for? So that's why we took this approach that we did.
So, Mr. Johnson, so I don't even read it that way. This doesn't say you have to be in their office and they have to examine you and sort of, it just says any physician who practices in an office-based setting shall provide. So somebody could call my office, I work in my office, someone come to my office and say, I got groin pain, I think I might have a hernia, how much are you gonna charge?
They're not your
Well,
patient.
they could come see, this doesn't establish that I have a physician-patient relationship with them. It doesn't establish that I have that physician-patient relationship with them. Someone could call my office and say, I have groin pain, I think I might have a hernia, how much do you charge? And I say I charge $200. They then expect that to be the charge. They come to my office, turns out they don't really have a hernia, they got God knows what. Now I gotta send them for CAT scans and x-rays and so on. I'm wondering whether we're actually creating true transparency for costing, which is incredibly complex, as I'm not gonna tell you two guys that, versus this expectation that people are gonna be better informed about the cost of healthcare.
Mr. Chairman, you could change the word "a" to "there," and that would solve that problem.
Am I misreading it?
I think the intent was it was gonna be your patient. It wasn't somebody just calling around doctor shopping for somebody, but if you wanna clarify that or something, fine with it. But it's
This
your
language,
patient.
yeah, this doesn't.
You could change the word "a" to "there."
And arguably, once a patient makes an appointment with you, you have a physician-patient relationship until they show up. If they just pick up the phone and call you, in the law generally, that's not enough to create a physician-patient relationship.
All right.
Mr. Chairman, members of the committee, Brent Rowling, Virginia House of Healthcare Association. I think we've already heard what we think about the top half of that bill. We just spoke about it earlier with Delegate Scano's bill. Just if I could, in the word estimate, I hear everything that everyone's saying, and we had this conversation a couple of years ago when the House Bill 905 passed to include that language in the first place. Estimate was carefully chosen, knowing that we don't always know exactly once you get in and open up the patient what goes on. So just that word was chosen deliberately.
All right. Anyone else in support? Yes, ma'am. Come on forward.
Yes,
Identify yourself, please.
Hi, my name's Diane Schreer. I live in Alexandria. I went to the dentist last week. This is very, very recent. I went in for general cleaning, and she said I needed a deeper cleaning, the hygienist. I rescheduled. I was leaving. It was awkward for me to get there, but I rescheduled it for 2 different times. And I asked her, I was like, what's the cost of this? Turns out it was over 10 times the cost that I had paid in another state 2 years earlier for it. I mean, this should have just been told up front. Oh, the cost will be. The important thing is I was not notified about it. And it's very, very easy to tell a patient when they, this is gonna be approximately that, good faith estimate. You know that if something comes up that you don't expect, it'll be different. I mean, that's common sense, and that's what an estimate means. And therefore, it is understandable that it may be more if something comes up.
Alrighty.
But an estimate gives you an approximation, and then you will know that based on insurance, it could be different, could be less.
Alrighty.
Thank you.
ma'am. You question of the respondent? No. Okay. All right, thank you very much, ma'am. Anyone else in the audience can speak in favor of House Bill 2427? Anyone in the audience?
I gotta just wrap it up, because this is the other bill I was interested in, Jill Hankin from the Poverty Law Center, and say, this is another small step forward. To me, this bill now means that when someone asks the question, the doctor's gonna come up with an answer and an estimate. Right now, people ask the question, they say, we don't know, it's all based on your insurance, and who knows what it's gonna be. Now they're gonna have to do a little bit of work to get a better response for the patient. So I think that's a step forward.
I would just ask, I definitely understand that conceptually, but what if the product that you're gonna get is not correct information, or because of all of the things that we've discussed? I do want the patient to have more information, but I want them to have information that I guess is correct.
Well, I get it, I understand your concern, but I think the physicians and providers will have to carefully answer the question and say, what we know right now, my office visit is X, but we don't know what we'll discover. Then as we go along, you can ask questions about additional costs. So it just doesn't excuse the conversation anymore.
All right, thank you very much. Anyone here in opposition to House
I'm in
Bill?
favor of it. I'm Dr. Elizabeth Hendricks. I'm also from Alexandria, Virginia. And I don't like surprise healthcare bills on the back end. It's ridiculous, it's unjust, and we need fairness in the healthcare system. This is outrageous. We need to have an estimate of some sort, and you can have the parameters of, well, if this happens or that happens or that happens, this price will change. But we need to know on the front end what our prices are gonna be, not on the back end. That's awful. Thank you.
Thank you, ma'am. All right, anyone in the audience in opposition to House Bill 2427 as substitute? All right,
Mr. Chairman,
Delegate Six?
I would like to move the line amendments that Delegate Levine is now going to move just a line item so we can talk about how the bill.
What are they?
So I would change in 37, I would change a patient to his or her patient.
I can't
Change
do that.
A to his or her. Or change to his, that's fine, yes. Change A to his.
Sheer.
And then I would change a good faith to an.
To what, I'm sorry?
An estimate. So it would read, shall provide upon request of his patient, comma, an estimate. And I think that would deal with the problem of it not being your patient. And it would also conform estimate to the words in the hospital setting. We get rid of the good faith. I would ask for it.
We just want to legal,
Yep.
see if there's a line amendments before we talk
Yep,
about the.
absolutely. All right, that's been moved and seconded, those line amendments without objection. All right, so everybody understands that, all right. Any further questions of the patron?
I would like to address some of the issues
Please.
that were raised. I agree with Delegate Robinson that when someone has insurance, we should give them the insurance cost. That's the way I would prefer to do it. That's the way my original bill did that. It met some complications with some folks in back. I still want to work to do that. But in the event we don't have that, which I agree is the best solution, giving someone an estimate of the cost ahead of time is, I think, only fair, because we have 60+% of people bankrupt in America because of healthcare costs. They go in, they think it's an ordinary visit, and boom, $30,000 for something that they had no idea was going to cost that much. That's just not fair. When I buy something, anything that's healthcare, I get to know the costs on the front end. And even if it's complex, even if it's a mechanic to my car, that's really complex stuff, they will tell me, your Weeble fixture's broken. I don't know what Weeble fixture is, but they will tell me the cost before and if I don't want it, I'll tell them, sorry, I'm not willing to pay that much, and I'll go to a different. I realize this is complicated, I look at this from the perspective, I admit, of the consumer, of the patient. Because the doctors, the physicians, the pharmacies, the hospitals, they are all far more sophisticated. The insurance, the pharmacy benefit managers, the people who are the least knowledgeable are the people using the system. And this thing is bankrupting people. And I don't think it's too much to ask a doctor to give an estimate of the charges. I think most good doctors do already.
WPC, you had a question?
Just an observation. I do appreciate the delegate's attempts here with transparency and what he's putting forward here in this expanded bill. I'm looking at this from sort of a macro policy and sort of a philosophical perspective. In law has become more of a business and less of a profession. Healthcare is not a commodity, right? It's not a good in the sense. It's a professional service. It's an environment where we want doctors and their patients to have protected relationships so that we get good outcomes, that there's quality, that there's value. This is not like parts and labor at the mechanic. And I don't want there to be a race to the bottom either. At some point, there are going to be professionals out there who are doctors, not this good doctor or Dr. Robinson, but like in the legal profession, with all candor, there are a lot of lawyers out there that are given pretty low ball prices, and my grandma used to say, "Get what you pay for." So I'm really concerned about how we balance this need for transparency and consumer protection and those elements in a business marketplace, but knowing that this is a professional service, that we have people's lives, in people's hands, and we want to make sure that we're going to get the highest and best from people in the community. So that's really just more my observation. I'm not prepared to support the bill as it is.
All right.
Yes, are the loan amendments happening?
Yes, ma'am.
I'm going to work with Kaufman.
It's the time.
Second. Continue to speak to it. Yes, just quickly, that I think this now is really the same thing, tell me if I'm wrong, same thing we did for the hospitals, just for a doctor office visit. And this is something I would do without this legislation. Anyway, I would ask this anyway, but now, maybe they would know, they might have the answer. So.
Those substitute motion, Mr. Chairman.
Yes, sir.
To lay it on the table and speak to that motion.
Second.
Yes, sir. Ultimately, it's difficult for the providers actually to give the cost, because it's ultimately the plans that dictate those costs. So you're actually putting a burden on providers to be able to try to queue insurance, to figure out what's going on, which changes their workflow, costs, and so forth. And it would be virtually impossible in this setting, especially an office-based setting like this, to give those costs, because it's ultimately the plans that dictate the costs. So whether you give them $1,000 price or a $5,000 price, that plan, no matter where they go, is still going to dictate that cost.
All right.
Address what you just said.
He addressed it. He actually, thank you. You shouldn't actually address that. You should address it before you made the motion, and I apologize.
I'm sorry.
So I tell you what, I'm going to give you the leeway because I gave him and I'll grant you.
Well, the doctor's offices know which plans that they're members of. So they can look up what the reimbursement will be with their plan.
That sounds
Good. Well, all right, that's good enough discussion. All right, fine. We have before us a motion to lay on the table House Bill 2427 that's been amended and substituted. The members of vote electronic voting record, the motion to lay on the table. And the motion to lay on the table fails on a 5-5 vote. So that brings us back to the original motion, which is to report as amended, House Bill 2427. So the members would vote on that motion. I move just to flip the vote.
Just pass you have to put
Maybe or maybe not.
You got it, I promise.
All right, so the motion to report fails on a 5-5. Delegate, thank you, thank you very much. We gotta move on, because
All right.
we've had a lot of.
Thank you, everyone, for your
3 hours.
time. And-
Delegate Edmonds, you are next in the queue, and draw this.